I will run, I will climb, I will soar.
Good morning everybody. Welcome back to my channel Shivani Dentistry, Parenting and More. I hope you all are doing good. And today I am back again with a very important topic on dentistry. Teeth are so much important than you think. They are the most ignored part of the body, if I must say, if I have the audacity to say that. And teeth have enormous amount of functions. A few of them which are of biggest importance are, of course, eating. And the more efficiently you eat and chew your food, the easier it is to digest. And in Ayurveda also it is said that the intestines do not have teeth, so all you do is the breaking down and chewing of the food, the breaking down of carbohydrates for that say starts in the mouth itself, and the efficient chewing enables good digestion and good absorption of the minerals and vitamins in the food present. So definitely what we put in the mouth, we have it a sense that this is good for my body and that I will do it. But if you do not have good amount of a proper set of teeth, you will not be able to digest and receive the 100% of it. Second comes the speech part, that confidence of speech, and there are so many dental related words which come with the lip and the tongue come in contact with the teeth, and then the pronunciation happens proper. So teeth are very much essential for our speech. And then of course comes for the shape of the face. We get a good support, the facial muscles get a very good support from the teeth within, and of course the shape of the face is also determined by teeth. These geriatric patients which have a flaccid mouth is because of the loss of teeth, and since the teeth are lost, the bone support is also lost, and because of that the shape of the face becomes distorted. So that is again one important aspect of the teeth. And of course, out of many, the last which I must say is the confidence. You meet with some people, the patient who does not have teeth stops to smile and greet others, tries to be an introvert person. So teeth are a very much important aspect in your confidence in life. A study in 2016 was done, and there was a clear correlation found that patients who had cardiovascular systemic diseases had some kind of untreated tooth infections in the mouth also. So it was a clear 2.7% correlation, I must say, to be very specific. So that was found in that study. And what happens, the bacteria what you have it in the mouth have very easy access to go into your system. They travel into your gut, they travel into your bloodstream, and the infection is very much reaching everywhere. So definitely teeth and the oral tissues are a very important aspect if you see to it. So in that study, they could make out that the bacteria which was found in the plaque of the patient was also present in the brain of the patient, was also present in the heart blockages of the patient. See, plaque, what it does, it holds a home to bacteria and that is attached to your tooth structure and the oral tissues, which they make a easy transfer into your oral gut, and from there it travels into your bloodstream. So that relationship is established in the studies. There was another finding that said that 95% of patients who had diabetes had some or the other form of gum problems in them. So your dental visits can alarm you for a systemic disease, an underlying disease also. So when the dentist says you that you need to go for a blood checkup or you must follow that advice and go for it, because somewhere or the other the oral bacteria may be harming your gut bacteria, and that gut bacteria in turn is harming your system. So mouth is the ultimate gateway to your body, and so many bacteria travels down through your system, and major reason being the plaque that holds the bacteria close to the teeth. So I would like to discuss a few non-medication methods to preserve the natural teeth. First being the brushing. There is a proper method of brush in which all the patients can come and communicate and say that we brush twice a day. However, we find a lot of plaque build up in their mouth. Along with that, there are a lot of developing cavities in their mouth. So what is going wrong? Where the patient is going wrong? Maybe you are doing it, but you are not doing it right. So the proper method of removal of the brush includes your upper up to down and down to up removal. The sweeping motion of the brush has to happen so that there is a proper cleaning happening inside the mouth. Along with that, the proper toothbrush is also important. Now there are two kinds of brushes that I would like to mention here. One is the conventional toothbrushes that we get, and in that category we get the hard, medium, soft, ultra sensitive toothbrushes, and then we have the electric toothbrushes. Electric toothbrushes are something that I would like to discuss it later. However, when it comes to hard brushes are not recommended for everybody. It is meant for the patients who have severe muscle spasticity, what we call it, or some kind of a paralysis in the muscles. So those patients are supposed to use the hard brushes. Medium brushes, soft brushes, ultra sensitive brushes have to be judged by your dentist, and they are supposed to recommend you the brush what you need to use it. See, not everything available in the market is for everybody. So that cautiousness has to happen. That cautiousness is there for every other thing apart from toothbrushes and toothpaste. As I said, people take it a lot for granted. Now we come to the electrical toothbrushes. Electrical toothbrushes are less abrasive, and they are recommended for patients who have overzealous brushing. Like they brush for 15 minutes or they brush. I have even heard patients who are brushing for 10 minutes in one stretch. So I don't know from where they get so much of time, first of all. However, this overzealous brushing rather than doing good is harming you, and more than that, it is making cavities in the mouth because of the toothbrushes. So for those patients, the electric toothbrushes have a timer inbuilt in them. So it stops after 2 minutes and it takes a pause. It cannot be on again. So those brushes are recommended for patients who are aware and want to make a break in the habit of brushing that way. So that is recommended for them. And of course, there are some patients who are in a pre-cancerous stage. They cannot open their mouth wider because of some cancerous condition, OSMF to be very specific that we call it, where the patient has reduced mouth opening and the patient is not able to open the mouth and clean all the areas. There the motorized brush can flow and it can do the work. So those patients, yes, definitely we recommend the motorized brushes for them. However, again, the best judge is your dentist. I would always say that please visit the dentist and for a customized, one-to-one routine plan for you. On the second part is that the flossing. Flossing is something that not all the patients do it. Brushing, out of 10 patients do it. Flossing, out of 10, 5 patients do it. So flossing is what? It is the removal of food deposited in between your teeth. There is a specialized thread kind of a structure that is available, and that is waxed in nature, and that slides between the teeth and it cleans the crevice area. Whatever is stuck, it can be removed. Again, there is a method and there is a tutorial kind of a thing that a dentist can show you with the models when you come to the dentist, and we can we have models and we have floss, we can guide you, we can train you to use a floss. So please visit the dentist and ask for flossing. It's very important for when you start developing gaps in the teeth and where the food is getting lodged and the patient is obviously alarmed by the food lodgement. So ask your dentist regarding the flossing. Now third comes the mouthwash, mouth rinse. Mouthwash is something that patients use it, and sometimes we see the abuse of it. So see, mouthwash is containing what a mouthwash does. A mouthwash flushes the area in between the teeth, and it reduces the amount of bacteria that is available in between the teeth, and it avoids the plaque building bacteria to develop for a longer period of time till the next time that you are brushing your teeth or so. It gives a window period kind of a thing, that I must say. And it is very good. Where the patient goes wrong is use of an alcohol based mouthwash, which is very fatal. I mean, if you use it on a longer term. So what happens at amount of good bacteria and there is a amount of bad bacteria, that microflora difference happens. All the bacteria are important to us. Everything needs to be in a harmony. So the good bacteria count has to be more and the bad bacteria count has to be reduced. So when you use an alcohol based mouthwash, it gives a certain dryness in the mouth. It gives a squeaky clean kind of a feeling to the patient, and the patient becomes a little bit more of addicted to the alcohol based mouthwashes. They are addictive in nature. And second thing, what happens that there is a certain amount of dryness experienced by the patient, and when you have dryness in the mouth, the saliva production reduces in the mouth. The amount of bacteria that is supposed to be reduced by the saliva, that function is not happening. So because of that, the plaque buildup might be on the same place itself. So the whole point of saying that that use of a mouthwash is supposed to be again customized by your dentist depending upon your situation. See, I say that brushing, mouthwashing and flossing is very important as a part of our routine, but when, where, how to use, that has to be customized by your dentist. So please approach the dentist and make a customized routine or make a care plan kind of a thing with your dentist, because customization is something which has to happen. It is a very individual thing. We cannot generalize a whole thing. Yes, it has to be done. Brushing has to be done, I can say, in a generalized pattern. Flossing has to be done, a mouthwash has to be done, but I am saying it as a general pattern. One to one, you need to get in touch with the dentist and they will customize it for you. Now, the what signs of a gum disease that I would like to say, I would like to say 3 gum disease signs are: bleeding of the gums while brushing, that means you are over brushing your teeth or there is some kind of inflammation happening to the gums. Second is a food lodgement between the teeth, the gums are shrinking there and that is the reason the food is getting lodged in between the teeth. And the third point is the loose teeth or the mobility in the teeth. So certain amount of tooth mobility is observed by the patient. So if that these are some things which are the early signs of gum problems. So gum problems, when you have, you are more prone to develop any kind of systemic disease. So for that you need to visit the dentist, so as you in the longer term you do not develop any kind of systemic disease also. See, both are going hand in hand, they both are in a circle. If you have a gum problem, you have more tendency to develop a systemic disease, and when you have a systemic disease, you have more tendency to develop a oral disease. So everything needs to be taken care. Your diabetes needs to be taken care, your heart things have to be taken care, along with your gut, along with your oral tissues as well. So for that one-to-one things, you must visit your dentist and let me know with your any doubts. I mean, if only I could give you a suggestion, I would be more than happy to lend out my knowledge to you. As I mean, it is always preferred to see a dentist. However, if you feel no, you're too far away from me and everything, and I would love to still give you advice and give your comments. Let me know how you like this video. This video is specifically made in request of my South Indian patients who prefer English to be as a language. However, I would make the same content in Hindi as well, because Hindi is something which I reach out to most of the patients here. And there are certain friends of mine who prefer Hindi over English. However, it is just a language and the connect has to be heart to heart. I am fluent in Kannada, Hindi, English. So you have any doubts in these three languages, you can feel free to approach me in any of these. So let me know with your comments, let me know with your opinion about this topic. You have any concerns? I have my contact details listed in the video down anywhere, and you can locate my clinic also, or I will put down the details here. So feel free to approach, feel free to call, and please like, share and subscribe the content. Thank you. Till next video, take care and have a nice day ahead.